So definition, assessing the mouth and the orphanage is used to describe the inspect an outer and inner part of the mouth, the sense of the taste. So the purpose is to provide the information on the conduction of the mouth and orphanix. So the equipments are pen light, gauze bandage, clean gloves, tongue depressor. So the consideration before, during, and after the procedure is to perform hand hygiene before and after the procedure and ask the patient for the oral problem. So the things to document after the procedure, document all the assessment, results, and abnormalities.
Perform hand washing. This is to prevent microorganisms. Inspect the outer and inner surface of the lips, nothing symmetry of the contour, color, texture, and lesion. Ask the client to purse his lips. This the variation, the color and texture may indicate poor nutrition and hydration, or aphoxylection may indicate happens simplex or other contiguous skin infection. Inspect the palpate, the inner lips, and buccal mucosa for the color, moisture, texture, and any presence of lesion. Carefully inspect. D may reveal the include lesion and first signs of the mumps, curd, sensitive ducts, and muscles. Ask the client to open his mouth. This to inspect the inside of the client mouth. Remove the dentures, if any, and able to may ask the patient to his, her, and himself inspect the condition of the feet. This to determine whether the iris is still intact and to check for. Inspect the teeth and gums for the declaration and disease of missing teeth. This to note for the abnormalities inside the patient's mouth. Inspect the root of the mouth of the color and structure. This to reveal any deformation in the hard, soft, palpate gestures of the palate. Inspect the surface of the tongue and the floor of the mouth. This to reveal lesion, color, texture, size, and the tongue. Ask the client to protrude his mouth, a tongue, and inspect the upper surface for color, texture, and position. May the reveal signs of the vitamin and mineral deficiency. Beefy and rock indicates vitamin B13 deficiency. The client place the tip of his tongue on the roof of his mouth. Use the pen light and inspect the other side of the tongue and frenulum floor of that mouth and submaxillary glands. This to reveal the surface presence of the saliva and the saliva, the visualize of any moisture that's developed in the area under the tongue. The client to roll his tongue upward, downward, and for the side to side to check the tongue movement. This to check for any district mobility. Wear gloves and palpate the tongue and the floor of the mouth. This to check for areas of tenderness. The use of the piece of the gauze, pull the tongue to the left and examine it, then do the same to the other side. This to reveal lesion of palpates of the sides under the tongue where the malignancies are common. The client to tilt his head back and open mouth as wide as possible. This to provide room for examination. Use a tongue depressor and shine a pen light into the oropharynx. This to note for any inflammation or discharge. Inspect the hard and soft palpate and tonsils. Note the color, shape, texture, and condition. This is to check for the presence of the abnormalities. Inspect the alveoli. Ask the client to say ah and watch the alveoli as the soft palpate rises. Inspect in position and mobility. This is to any deviation to the side or absence of movement indicate nerve damage. Inspect the tonsils for color, ulcerations, exudate, and enlargement. These two tonsils that are swollen prior to the have an exudate may leave an infection. Test the gag reflex by touching the back of the soft palpate with the tongue depressor. This to check for the presence of gag reflex.